Hello, everyone. It's Wednesday, May the 12th. Regretfully, our number of deaths have jumped up a little bit. This is probably a little bit of a lag from over the weekend, like we said, as far as the reporting, but we have 19 deaths to report in West Virginia. I'll go through them right now. The 2,730th death is a 90-year-old female from Jefferson County. The 2,731st death is a 51-year-old female from Fayette County. The 2,732nd death is a 72-year-old female from Roane County. The 2,733rd death is a 65-year-old male from Putnam County. The 2,734th death is a 70-year-old male from Mineral County. The 2,735th death is a 62-year-old male from Putnam County. The 2,736th death is a 91-year-old female from Monongalia County. The 2,737th death is a 55-year-old male from Monongalia County. The 2,738th death is a 72-year-old male from Berkeley County. The 2,739th death is a 71-year-old female from Marion County. The 2,740th death is an 84-year-old male from Raleigh County. The 2,741st death is a 44-year-old male from Mercer County. If that's not young enough for you and everything, we've got one just in a few lines down that's 40 years old. It's terrible, just terrible. The 2,742nd death is a 58-year-old female from Mineral County. The 2,743rd death is a 59-year-old male from Ohio County. The 2,744th death is an 86-year-old female from Wood County. The 2,745th death in West Virginia is a 40-year-old male from Harrison County. The 2,746th death is an 80-year-old male from Ohio County. The 2,747th death is an 88-year-old female from Wetzel County. The 2,748th death in West Virginia is a 97-year-old male from Pendleton County. Let me just say one thing. Whether we lose a person, that's in their 20s or their 40s or they're 97 or they're above 100, we treasure all life. When life ends with someone that's 40 years old, it's tough enough when we lose someone that's 97 and we lose all that incredible wisdom. But when life is snuffed out before you even hardly get started, it really, to me, is really sad. Keep all these folks in your prayers. Don't let them feel alone. 340 new positive cases in the last 24 hours. The daily positivity rate is at 4.03. Our cumulatives tick down a little bit more. It's at 5.13. And our active cases tick down a little bit more. They're at 6,716 now. Our recovered cases continue to go up. They're 147,751. Maybe I ought to throw that graph up, And you can see that top graph, we want it just wider and wider and wider. We have 264 people that are hospitalized and 90 in the ICU units and no red counties. That's all good. Now, we want our hospitalized to fall and we want our ICU units to drop way off. No red counties is good. The reminder of your 65 years of age and older, especially you, this disease attacks you like nobody's business. So if you feel the least bit sick in any way or unusual in any way, if you'll just go get a test, we'll save your life. We'll save your life with the antibodies. So please, please take advantage of the free testing. It's right there for you, and this is a perfect example of you can take a horse to water, but you can't make the horse drink. And, so please, please try, if you would, please, to go get tested, and then we can react properly and timely and have a real shot at saving your life. I want to talk to you about the gas shortage per se and the Colonial pipeline, and we're monitoring this situation up and down one side and down the other, and we really are on top of it. And with all the federal and the private sector people and everything, everybody is watching what all's going on. You know, at my request, West Virginia was added to the amended regional emergency declaration by the Federal Motor Carrier Safety Administration, which will allow easier transportation of fuel to affected areas. The best advice that I can possibly give you is to just stay calm. You know, the bulk of our gasoline that comes into the state of West Virginia does not come on the Colonial pipeline. It comes on the Plantation pipeline, not the Colonial pipeline. The Colonial pipeline is not even a significant fuel source in West Virginia. We basically are creating our own fuel shortage right now. Now, I want all of us to make sure we've got gasoline, and this thing, just like a pandemic, in many ways could turn around and whip and back on us and everything, and the situation could get more serious than it is today. But right now, we are creating our shortages. You know, there is no real shortage of fuel right now in West Virginia. It's simply a transportation logistics problem, and that, in essence, creates a shortage. But with that, you know, we are having people hoard gasoline like you can't imagine. You know, we have pictures, and I think it was in Barbersville, where, you know, people are showing up with a flatbed trailer with what looks like, probably liquid fertilizer crates, and they're filling up the crates on a flatbed trailer. You know, now, the odds are this is going to get cleaned up, but you should make sure that you have adequate gasoline, you know, for emergencies or whatever it may be, because we could have hoarding or whatever, and the gasoline station that you're used to buying gas from may be out of gas. And so from the standpoint of just cautionary, good sense protection, have gasoline. But for crying out loud, you know, we're in pretty decent shape here, really. So we'll keep you abreast and everything, and we're going to continue to stay on top of it. And it's nowhere close in West Virginia to being as serious as maybe a lot of people have led you to believe. Vaccine eligibility is 16 and up. You know, the 12 to 15-year-olds, you know, that if you have an emergency use situation on Monday, you know, it was authorized that we could use Pfizer on that. You know, the CDC will meet today to consider recommending the vaccine for all 12 to 15-year-olds. We stand ready to be able to move, and we're ready to go. You know, there's 78,000 of those kids in our state, and we're going to make them available as soon as we get the go-ahead from the CDC. You know, the Department of Education estimates with the over 78,000 12 to 15-year-old students that will be eligible all through the earlier grades. I go back to our young people that are 16 to 35. We're making headway. We're really making headway. And absolutely, we need more and more and more of you to get a feeling of patriotism and step up. You can't imagine how much is just hanging with you right now. How important it is for you to step up. And so with all that being said and everything, just keep it up. You'll see in just a second, I'll tell you about our numbers. Our numbers are gradually getting better and better and better. We're on a good pathway and everything, but we just got to stay with it and everything. We could really stand more 16 to 35-year-olds stepping up. From the standpoint of the savings bonds, I think the way that that's going to fall out is we're going to be able to offer people a savings bond if they choose to go that way. You know, they're going to have to give information. They're going to have to, we're going to have to get information, when they're basically getting their vaccines, where we can get them in the pipeline to be able to do that. Others, we're going to give, a real nice patriotic looking little card swipe and everything that you'll have and everything, and that you'll keep, as your keepsake there. And it'll have beat 588 ... bad, and it'll have a picture of the West Virginia flag as well as the United States flag. And so, again, we're really proud to be able to do something to motivate our 16 to 35-year-olds. Most of them think they're invincible, and so we really just need to get more and more of them vaccinated and shut this thing down. Our vaccine distribution update, we're 85.8%, of first and second doses administered, right now this week, I guess, in the state of West Virginia. Our goal is always 100%. There's over 2/3 of the 65 and older population. In fact, that's at 71.6% that have both shots, that are fully vaccinated. It's amazing. That's really, really good. It's well over 80% now have one shot. And I'm sure, when those that have the one shot, that their time is to get their second shot, they'll be doing that. Our goal is 85%. We'll get to that in just a second. Pay really close attention to these numbers. These are the numbers that are really, really meaningful. We now have 55.6% of everyone in West Virginia that is eligible to get the vaccine. 55.6% have at least one shot. And 46.4% are fully vaccinated. So I am not really, even though I love the number 46.4 because that probably leads the nation or is there close to it, on fully vaccinated. But the number that I'm really watching the most is first doses. And we've climbed from 52, or 51 just a few days back to 53 and slowly to 54. And now we're at 55.6%. And our goal in a call to arms, that's what we called it, call to arms. Our goal is to be at or above 65% of the total eligible population in the state of West Virginia. 65% is the goal that we want to get to. And right now we're within 8.4%. And we're knocking on the door, and we're just going to keep right at it until we get there. Like I said just a few minutes ago, we're at over 80% of the 65-year-olds. A goal is to get 75% of the population between 50 and 65 and be at 65% or higher that have at least one shot, when we get to our state's birthday, and these masks will leave us at that point in time. So if you're, again, just a reminder, if you're 65 and older and still waiting on a vaccine, just pick up the phone and call us. All you got to do is call us on that hotline right there, and we'll come running. We'll get you the vaccine. Remember, this dreaded killer is targeting you, and so we really, really need to get that to you. As far as the manufacturing and our church outreach and everything, from the standpoint of doing our congregations or our employees at different businesses, please just call us. We'll set it up. We'll make it happen. We'll make it easy and convenient for your people. From the standpoint of the COVID-19 vaccine info line, it's all up there. A reminder, again, I say over and over and over that this is so safe. All the medical experts, just say what an incredible, incredible blessing from God above this vaccine has been, because how effective it is and how safe it is. But in the meantime, you got to remember right here, your mask. These little doobies have done an incredible job. They have saved so many people's lives. And so even though we don't like them, just hang with it just a few more days, and we're getting there. Now, your free testing's all up there. It's again, take advantage. Please take advantage of that. Fruth and Walgreens, thank you so much again, over and over. We have 14 outbreaks in our long-term care facilities. That's down just a little bit. We have 8 outbreaks in our churches in 5 counties. That's down a little bit. Those counties, Greenbrier, Hardy, Jackson, Nicholas, and Ritchie counties. In our call to arms announcement, our initiative that I announced, just a few days ago, the mask mandate will be lifted on our state's birthday on June the 20th. I am encouraging over and over to get our kids that are 16 to 35 vaccinated. We're waiting on the CDC on the kids that are 12 to 15. Our goal is to be at 65%, of all those that are eligible in West Virginia, whether they be 12 or 16 and above, and be 75% of all those 50 and above, and be 85% of all those 65 and above. It's still mandatory. You wear your mask in public buildings, and please, please, please continue to do so. And like I said, we're on the glide path now. We're absolutely on the home stretch, and so let's just push this thing right over the top together. You've done so good, West Virginia. It's unbelievable, and you could never, ever have given me anything to make me more proud than to be able to lead you to have gotten us where we've gotten to right now. And you've done it. You've really done it. So let's continue to help one another. Help me. Absolutely look and help your neighbors and everything. Get these kids vaccinated. Please help me get these kids vaccinated. Give blood, especially if you've had the incredible blessing of healing from this dreaded killer and everything. I think you surely ought to seriously consider giving blood. From the standpoint of our state park vaccinations, as part of our ongoing efforts to get more West Virginians vaccinated, we are going to hold free vaccination clinics at all West Virginia state parks between now and Memorial Day. Before Memorial Day, we are going to start with several of the high traffic areas, and we'll add more as needed. On Memorial Day weekend, all West Virginia state parks and forests will offer vaccines to employees, employee families, and any park guest. The clinics will be set up outdoors, and all the other details and everything are up on our West Virginia stateparks.com. It's WVStateparks.com. A lottery clinic, the West Virginia Lottery and the Joint Interagency Task Force have scheduled a mobile drive-through COVID-19 vaccination clinic this Thursday and Friday, May 13th and 14th at the Lottery Building parking lot in downtown Charleston. The clinic is open to the public. It's open to the public. This is not just open to lottery employees. It's open to the public from 9 a.m. to 5 p.m. both days. No appointments necessary. Just drive through, get your shot, and drive away. It's simple as mud and everything, and absolutely, we again thank all those that are working so hard, whether it be the DHHR, the National Guard, all the folks in Kanawha County. It's just amazing, from the Lottery Commission and on down to all the good stuff that you've done. And all three of the vaccines will be available there, and I think we'll give you your choice of vaccines and keep people moving and moving very quickly. The FCC Emergency Broadband Program. All right, now I'm going to slow down and I'm going to just talk to you just a second about this. There's money available to households. Now, it's not all the money in the world, but $50 and $100 to certain households are a lifeline. Now, the U.S. Federal Communications Commission is using stimulus money for an emergency broadband assistance program. There's $3.2 billion of emergency broadband benefit that provides a discount of up to $50 per month toward broadband service for eligible households. The benefit also provides $100 per household discount toward a one-time purchase of a computer, laptop, or tablet. A household is eligible if one member of the household meets at least one of these criteria below. So, just so everybody won't get all confused, there's a $50 per month broadband service for eligible households. In addition, there is a $100 per household discount one time on a purchase of a computer, a laptop, or a tablet. Now, there are 3 different ways that household is eligible for the $100. Here they are. A household has to have an income that is at or below 135% of the federal poverty guidelines. So you've got to have an income that is at 135% of the federal poverty guidelines. Now let me just make it real easy. If the federal poverty guideline was $10,000, you have to be at $13,500 or below to be eligible. Now, in addition to that, if you participate in the SNAP program, Medicaid, or the FCC's Lifeline programs, you're eligible too. If you are approved for benefits under the free and reduced price lunch program or the school breakfast program, you're eligible as well. All you've got to do is qualify in one of these areas and you're eligible. And the last one is, if your household income is significantly higher than the poverty level and you're not in the SNAP or Medicaid or the FCC's Lifeline program, or you're not getting free lunches or whatever, free breakfasts at schools, and this is the last one, and you have experienced a substantial loss of income through job loss or being laid off as a result of the pandemic, you're eligible. So take advantage of that. Really and truly, this is just additional Fed dollars coming into West Virginia. It has a multiplier effect, and it can help some families and folks and everything, so take advantage of it. Last thing is just this, and we've been watching this real close for a long time, and we don't want to be redundant. I'll come and be with you every day. I'll answer your questions every day if you choose for me to do that, and would love to do that and very proud to do that. But next week, we're going to only hold 2 briefings, and then the weeks thereafter, we're going to go on Tuesdays and Thursdays because our viewership and everything is not as strong as it has been, and I think we can do this in a better way by doing it 2 days a week now. If things get tough or rough in any way, we'll go back to 5 days a week. I have no problem with that in any way at all. But going forward, I will hold my briefings on Tuesdays and Thursdays after next week. Next week, we're going to go on Monday and Wednesday because we have some conflicts later on in the week and everything. But Monday and Wednesday, and we will not have a briefing next Friday, May the 21st. And then after that, we will go on Tuesdays and Thursdays. Nevertheless, I thank you so much. That's it for me right now.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. As the governor pointed out, our trend line still is moving in the appropriate direction. We still continue to have people getting vaccinated. As he pointed out, we have a number of events this week. There are over 38 clinics being run. There's also, as the governor pointed out, events at state parks. The Strawberry Festival is hosting a clinic. We have our schools ready. A number of counties have already done all the pre-work and prepared to provide vaccines. They will be available to both students 12 to 18, but as well as parents. As the governor pointed out, a large event at the lottery that will cover not just state employees, but also the general public as well. In addition to the work that we continue to do on vaccines, we have not taken our eye off the ball for the need for PPE, particularly if we would have issues later this fall or in the winter. So we have done a lot of work over the last couple of weeks, particularly the National Guard and DHHR logistics teams, in getting out PPE to boards of education, emergency managers across the 55 counties, as well as local health departments, and will provide additional PPE to our Division of Corrections. Testing continues to stay steady, although it's decreased over the last couple of weeks. But we, as the governor points out regular, if you haven't had a vaccine and you're feeling sick, please go get tested. Then, when appropriate, get a vaccine. So again, a lot of great work. I again encourage all West Virginians to take on the personal challenge and responsibility of getting a vaccine, not just to protect yourself, but to protect those around you and your community. Thank you.
Thank you, sir. Next, we'll go to Secretary Bill Crouch with the DHHR.
Hello, everyone. I want to echo what the governor says at every briefing. Even though our numbers are leveling off and even dropping, and we're looking to get back to normal, testing is crucial to fight this pandemic. And this virus is still out there. It is still in our communities. So as the governor says over and over, if you are experiencing any symptoms, such as coughing, a sore throat, runny nose, fatigue, body aches, or if you feel like you've been exposed to someone who's had COVID, please get tested. We have free testing events throughout the state. These events are open to all West Virginia residents, including asymptomatic individuals. If you have any concerns at all, please get tested. Find a list of events near you. You can visit the COVID-19 website or follow us on social media. So for now, wear your mask. Please get vaccinated. Get your family vaccinated. Get your children vaccinated, and be safe. Thank you.
All right, thank you, Secretary. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. So as you did hear, and the governor announced it as well, Pfizer did announce that the 12 to 15-year-olds for the vaccine was approved for the EUA. We are waiting for the CDC to also review it today, so we're hoping to hear that out this afternoon. Once that has been announced, we are ready to vaccinate 12 to 15-year-olds with the Pfizer vaccine in West Virginia. We are hoping that parents will take children to the vaccine clinics, and we're ready to push that out as soon as possible. The vaccine is proven to be effective to save lives for not only children and adults, and to reduce anyone to get sick. So we are encouraging for all the adults and children to get vaccinated in West Virginia to get back to as many normal lives as possible, to visit family and friends, and to enjoy the activities that are coming up throughout the summer. So as soon as we get that word from the CDC, who's supposed to meet this afternoon, we are ready to launch all the vaccines out to the different schools, to the different venues that are mentioned, to all the state parks. So please get your children vaccinated. It is very important. Thanks, Jordan.
All right, thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. My question is for Major General Hoyer, retired, about the surge that you're going to see in requests for Pfizer vaccine. How logistically are you going to handle that? Is that a major challenge now that the kids are going to be coming online probably as early as today, according to Dr. Amjad? Thank you.
Okay for me to take that, Governor?
Oh, sure. Go, General.
Yes. So, Paul, we see no issues with the availability of Pfizer vaccines. We continue to order our maximum dose allocation of Pfizer, and Pfizer continues to be plentiful across the United States in their production process. So, at this time, no major issues of any kind with making those vaccines available.
All right, thank you, Paul. Next, we'll go to Mark Cram with WDVM.
All right, make sure I'm clicked there. Good afternoon, Governor. Good afternoon to everyone. You know, a lot of data has been gathered over the last year as far as ages of individuals who were afflicted, infection rates, things like that, and then the turnaround with the vaccine. I'm curious, maybe particularly from Dr. Amjad, how this data can be used in the future. What can we learn from all of this? Because it seems that there's been certainly more careful tabulation of this information than ever on any flu seasons or anything else we've had. And second, Governor, congratulations on the success of these weekly press conferences. I think it has tied the state together. I'm wondering, would you consider at least maintaining one press conference a week virtually like this to keep the Eastern Panhandle tied to its state capital? Thank you.
Let me ask before Dr. Amjad goes, let me promise Mark I'll do this. Mark, good Lord willing, the creek doesn't rise, I'll come here for absolute certainty. I mean, we'll do two, you know, and in hopes that we'll reach a point in time where we'll get rid of this terrible killer. If by chance this thing gets ugly again, we'll go back to whatever we have to. If it's 3, if it's 5, that's okay. You know, for crying out loud, if you remember, I came here on Christmas Day, you know, and so I truly am going to come with whatever need. But Mark, I will promise you this: I'll come at least one day a week from now on, because I really believe that it not only helps everybody across the state that, you know, that can come up with, you know, if there's a question from the news media or whatever that affects their area, but it keeps us all in touch with one another. But on top of that, it helps me. And it helps me be a better governor, because the more that I hear from you, the more that I'll learn. You know, I've said it over and over. The more we test, the more we learn, the more we know. You know, how many times have I said that? How many times have I said, the more we test, the more we know? And so yeah, Mark, I think it's a good idea. I'll be here. I'll be here, brother. And we'll try to set it up to do those on Wednesdays, but for right now we'll go to 2 days, and then we'll stick it to 1 day, because I think it's a good thing, good way for you to see the governor and talk to the governor, for Charleston to be in touch with all parts of this great state. And you're right, I hate to say it, but so many times, you know, the Eastern Panhandle or other great areas in our state kind of feel like they're not really, you know, the people in Charleston are not really in tune with what they're doing there and what's going on there. And so good point. And yeah, I've already thought about that. I'll be with you 1 day a week forever. And Dr. Amjad and Dr. Marsh isn't with us, is he? Okay, Dr. Amjad, we're up to you now.
Okay, sure. Mark, to answer your question, I mean, we did learn a lot about the ages and about the COVID-19 pandemic, but, you know, we did see that a lot of older people suffered with the pandemic, so we got a lot of information with that. But we also learned that addressing older people early on, for example, with the vaccine. So, you know, our governor did want us to target our older age groups early on with the pandemic and the vaccine. So I think we benefited from that. So as far as other diseases go, like you asked about the flu, we know that that's important. We also know that, for example, the masks helped with our flu cases. So I think as a public health perspective, we learned a lot for that. So we know certain things can help in the future. We also know how to prepare in the future with other health diseases going forward. But, you know, I think also learning how to pivot and how to address things in the future can also benefit us from that perspective. But, you know, we got a lot of information with this pandemic going forward for hopefully in the future, any other diseases coming about, we can benefit from that. But overall, I think we did well as far as West Virginia goes in handling this and for the future generations. But a lot of information was gathered in the last few years, but hopefully that answers some of those thoughts that you had.
All right, thank you, Mark, and thank you, Dr. Amjad. I apologize, I didn't mention that Dr. Clay Marsh, our coronavirus czar, had a prior engagement today, and he will rejoin us on Friday. Next question will come from Charles Young with WV News.
Hi, this is Charles Young with WV News. I had a couple of questions about this next younger age group of folks. Are there any plans to extend the monetary incentive, whether it's a savings bond or a swipe card, to the younger kids? And then do we have a relative timeline or hopes of one of how quickly we think we can get through these 78,000 kids? How long do we think it'll take us? Thank you.
Charles, I missed part of your question, but repeat your question, please, sir.
Yes, sir. I was wondering if we were going to extend the incentive, the $100, to the younger group of kids. And then I wondered if we had a timeline or a hopeful timeline of how long it would take us to vaccinate the 78,000 in that age group. Thank you.
Well, Charles, I'm going to have to pass for just a little while, but with that, I'm going to go back and try to find a way to be able to do it. I don't know if we can do it or not from the standpoint of the monies, but if we can find the money and everything, I think it'd be great to do that for those kids as well.
All right, thank you, Charles. Next to Mark Curtis with Next Star Media.
Good morning or good afternoon. I don't know what we're doing. Good afternoon, Governor and Cabinet and fellow reporters. Governor, I want to ask you, this is a COVID-related story, but it's not a medical story. I believe 5 or 6 state governors have announced they're going to stop giving the $300 state supplement to the federal unemployment insurance because businesses in their states are having trouble getting workers to come back. And so are you considering that at all, getting rid of the state supplement? I don't know what level it is at now, $300 or whatever. Are you thinking about doing that, or what are your thoughts?
Mark, this is a great question, and I love it and everything, because when somebody hits right on something that we're really dialing into, Mark, we got a lot of folks, and you know it and I know it too. We got plenty of folks that are hurting. And I'm not speaking of those folks in any way, but you got a lot of folks that are scamming the whole system, and they're taking dollars that was meant to really help them, and some folks are, saying, well, look, I'm better off not working. I'm better off. I can go trout fishing this afternoon. I mean, for crying out loud, I'm gonna go trout fishing, and our businesses are suffering. Our businesses are pleading with our people, we got to have you back to work. And so not only are we looking at moving forward to shorten that time period and not go all the way out to its end, but we're also looking at another trade-off that could really help with incentivizing those folks to get back on the job. We need them back to work. Mark, this nation was built on people's work, and I'm a real believer that work brings real gratification and it brings honor and everything else. We got to get our people back to work, and so not only are we looking at it, we're looking at another alternative coupled with it to really try to drive more people to get back to work, because our businesses need them.
All right, thanks, Mark. Next, we'll go to Joe Buchanan with WDTV.
I appreciate the time, but that was my same question, so I will withdraw. Thank you.
All right, thanks, Joe. Next to June Leffler with West Virginia Public Broadcasting.
Hi, Governor and panel. So I wanted to get a little bit more information about the $100 savings bond. I know that some things are still being worked out, but it has been a while since this was first announced, and today was the first time I've heard you say that, people might need to choose whether they want that. They need to, do some sort of action to opt into that. So I really want just more information on if this is going to happen. And I don't say that from a standpoint of, gosh, I want my $100, but I've talked to behavioral experts, and they say incentives work, and they say that your $100, really could work. But if people are not sure when they're getting it, or it's going to just come in the mail at some point that they don't know, that it doesn't really work as an incentive. That's not how they work. So any information is appreciated.
Okay, June, I couldn't agree with you more. We ran our little snafu along the way was, maybe maybe I've got, a little bit too much gray hair. I didn't realize that the saving bond, was not issued the way it was when I was growing up and everything, or buying bonds for our kids. And so with that, then we tried to get Treasury to be able to do a special deal for us. And then we switched gears and we tried to do the silver dollar thing, and that turned into even more complications. And so where we've landed is this. We first of all, anybody that's 16 to 35 years of age will get this. Go get vaccinated. Don't hesitate a bit in the world. Go get vaccinated. And it's coming. It's on the way. The other thing is probably what we're going to do is just this. We're going to give anyone that wants to go the savings bond route, but as I understand, they're electronically done now. And so you won't physically get the real savings bonds like we used to get years ago. But what we have to have is we have to have an account, and we have to have a little bit of information from the person going in to get the vaccination. Now, on the other hand, from the standpoint of the $100 just gift card, we're now getting all those printed, and they should be done. I would think they'll be done this week. And so everything is imminent. Everything's happening right now. So we're really close on it. So June, you're right. Giving people a carrot and then really waffling on when and how they're going to get the carrots. People can be real motivated and then lose the motivation. We don't want to do that, and that's why everybody's been working all hands on deck to get this done. And so it's been a little more difficult than what we thought it was going to be, but we're getting there. We're going to have this thing ready to roll latter part of this week or the first days of next.
All right, thank you, June. That's all the questions we have for today. So, Governor, I'll turn it back to you.
Okay. I want to remind everybody that we will have our briefing this Friday, the 14th. We will have briefings on Monday and Wednesday only next week, and then Tuesday and Thursday thereafter, unless we get into a situation to where we have a real need to go back to 3 days or whatever it may be. And I was going to report to you one more thing, but I'll let that go. I had a little funny to tell you, but I'll let that go. But anyway, nevertheless, West Virginia, just keep doing what you're doing. Remember these 19 great individuals that we lost and all their loved ones. Keep them in your prayers and stay together, West Virginia. That's your strength. Your strength is just that. I mean, when it really boils down to it, so many of the other states have had all these luxuries and things that maybe we didn't have here in West Virginia. But you've stayed together. You've stayed together arm in arm, absolutely in lockstep with one another. And look what you've done. You've put it on all of them. You really have. And absolutely, if you'll just do the same thing, we're going to run across the finish line together on this one. We'll get rid of these masks on the 20th of June, on our birthday, 158 years. And absolutely, West Virginia, you are absolutely the model. It is flat believable what has happened over the last 3 or 4 years. I mean, you have come from the state that everybody thought was poor and dingy and dark and poverty-stricken everywhere, and education no good, and we knew better, but the outside world didn't know better. And you have changed that so much in that you have become that diamond in the rough that everybody's missed. You have absolutely changed deficits to surpluses beyond belief. There is so much goodness and so many opportunities that are right at our fingertips. We can't blow our legs off. We've got to continue to look to the future and legislate and move this state to the future. We can't sit on our hands right now. If we sit on our hands, these days of goodness will leave us, and we'll be right back in a dog's mess. So nevertheless, I thank you so much, and we're going to keep at it. Thank you again.